Thank you for the introduction. It is a great honor and pleasure to be here today. And I want to thank to the organizational committee and notably to Professor Papatanasiou and Professor Panayotov for inviting me. So today I will present a very small part of the work on behalf of Professor Berteanu, who unfortunately cannot be here and attend the conference. So what is a SWOT analysis actually? It is basically an acronym. So it comprises the strengths, the weaknesses, the opportunities, and the threats. So what are the strengths? What resources can we use? What are the advantages? And what is working well? So what do we know? The weaknesses reflect the abilities that we are lacking. Also, where are we going to struggle? Where is this going to go? And how can we overcome these shortcomings? Also, the opportunities are valuable. They are focusing on strengths, the trends that can work in our favor, and the prizes or the outcomes that we are having in the end. Also, there are the threats. So what threats do we face? How or on what extent can this challenge us? And what could go wrong? So what can we do in order to make everything better? So how to optimize the results in the PRM field based on a SWOT analysis, and why do we use this kind of analysis? So this seems to be interesting and a fit evaluation tool, not only to promote the awareness among service providers regarding the functioning of a rehabilitation program, but also it can foster active participation in the organization or reorganization of a service delivery model for rehabilitation, also including the pediatric population, rehabilitative focus. So PRM organization based on a SWOT analysis comprises the strengths, the weaknesses, opportunities, and threats. So what are the strengths in PRM field? Favorable organizational climate, interdisciplinary work, but not only interdisciplinary, but also multidisciplinary work, better guidelines, active goal setting, tailored approach for the individuals, and follow-up, and also better outcome assessment. The weaknesses, unfortunately, we also have to take into consideration the weaknesses. So the lack of psychological support to families, also long waiting lists, not only for the adults, but also for the children, occupational and social reinsertion, non-attained goals, and a decreased quality of life. What are the opportunities? Well, the opportunities consist on working with various community providers, being up to date with the latest trends, adapt them for our patients, for the individuals, to obtain better outcomes, and of course, a better quality of life. What are the threats? Unfortunately, there are some threats, but sometimes we can use them in our favor. So late intervention timeframe or lack of information to adapt the rehabilitative program, also fear of losing professional autonomy with the changes in the framework in a new service model. So the SWOT results help redefine or better define program goals and make informed decisions to improve service rehabilitation, coordination, and better outcomes with long-lasting effects. So if we focus on the Cochrane collaboration and analysis of the most prolific groups in the PRM field, we can see that the rehabilitation is having some trends. So the first one would be the musculoskeletal one. So there were 28 reviews taken into consideration. The second one is focused on stroke. The third one on back pain, and the last one, the movement disorder group. So we can see that are actually 4 main focuses or 4 hot areas or trends. So the most discussed intervention type consisted of exercise. Also, the exercise part contributed to the physical medicine and pharmacological intervention. So it was a joint effect, because as we all know, there are not only some things that work. You have to do more and better to work together and to have a better effect. So 6 other reviews dealt with multidisciplinary rehabilitation, which is very important. We are focusing on this as well. Low back pain treatment and stroke were also the most investigated topics in the PRM field. And also, we can draw a conclusion that the Cochrane collaboration serves as a main step in increasing an evidence-based approach to medicine, but also to rehabilitation, aiming for better outcomes and increased quality of life. So thank you so much for your attention.